and welcome to Wellness Live. My name is Dr. Olivia Moses, and this broadcast is brought to you by the Living Whole Wellness Program right here at Loma University Health. Welcome if you are watching us for the first time or if you are watching us for the first of the year live. So this is our first session for 2024. Today we are talking about a very interesting topic. Now, some of you might have jobs where you sit a lot, maybe in front of a computer screen. Some of you may be walking a lot. The thing that we need to remember, or the take-home message, is work shouldn't have to hurt. And there are a lot of things that we can do potentially to prevent these things. So today our special guest is Aubrey Prince. Aubrey Prince is our certified ergonomic specialist here at Loma Linda University Health and is here to talk about just that. How can work be actually healthy for us in the way we use our body? So without further ado, I'd like to introduce you to Aubrey Prince.
Thank you for that introduction. Let me share my screen here for the presentation. Like Dr. Moses said, the goal of this presentation is to talk through how we can reduce our risk for pain here at work. And the title of this presentation is The Irony of Healthcare Workers in Pain. And what we'll do in this presentation is a couple things. Mainly ending with what we can do about some of this. But before we go into what we can do, first objective is how big is the healthcare worker injury problem? So we'll all align on that. The second thing we'll look at is how Loma Linda compares, because if you're nosy like me, the first thing I would think after that first question is how do we stack up? Why the problem exists. And then, like I said, the meat and potatoes of the presentation, what can we do and what can the institution do? So jumping right in to some numbers. In private industry, 2.8 employees out of every 100 sustains a reported workplace injury, so a workers' compensation injury. 2.8 out of every 100, according to the Bureau of Labor Statistics in 2022. For comparison, in healthcare, that number is 4.4 out of 100, 57% higher. Hence the title of this presentation, right? The irony, because we're here trying our best to prevent pain, to reduce pain. And the statistics show us that we are 57% higher in our pain injury rates than the private industry. A number for you, because I always like to equate injury with cost. This is one figure, 1 billion, over 1 billion in medical costs and lost productivity. And that's just from nurses annually is the estimate US wide. So that's a lot of money, and it's a lot of money that we spend here at Loma Linda as well. Just so you can see how we stack up. Like I said in the last slide or a previous slide, healthcare is 4.4 out of every 100. Loma Linda, according to the latest data that I received and the calculations that I performed actually just this morning, so it could be the latest I could possibly get it, 9.7 out of 100. So we have a ways to go. We're improving. 2023 will be better. So there's the limelight, the positive. But we do have some room for improvement for sure in this space. So let's break it down to some professional levels. So lab professionals, any lab professionals watching this presentation, so that would be pathologists, lab techs. There's studies done on different segments of healthcare workers to see what their pain incident rates are. For lab professionals, it's about 20%. For physicians, it's about 20% that say they report being in some sort of pain at any given moment. For radiologists, this is just neck pain, it's 25%. For surgeons, it's actually 40%. And if you want to nerd out about why that is, you can always ask these questions later. either in this presentation if we have time or elsewhere. Office workers, it's about 40% as well. For dentists, it's 60%, which surprised me when I looked at the research when I first switched over to healthcare. 60%. Nurses, this is just back pain, is 75%, which is really high. And then the highest incident rate that I found in doing this research over the last couple years, year or so, sonographers, 80 to 90%, which is massive. So chances are, if you're watching this presentation and you're working here at Loma Linda, you or someone you know has recently or is experiencing some sort of pain. So all of this stuff that we talk about from here on out should be relevant information. So knowing all of the context of how big the problem is, the next thing to ask is, okay, why? What are the reasons for this? And it's complicated is the short answer. But the more educated answer is there's some models out there that help to understand and explain why healthcare worker injury rates are so high. And the one that I resonate with the most, given my personal experience, 12 years in the industry plus Loma Linda experience, is this person environment fit theory. This is a model that was developed in the 80s by some researchers at the University of Michigan. And what they sought out to do is to put together all of the factors that go into these musculoskeletal disorder injuries that make up most of the data that we just looked at. What are all those factors, and how can we put those together in a model that explains how we go from factor to the output of the injury? So we're going to walk through this model super quick because it is a really good foundational principle. If you as an individual are watching this and want to understand, okay, how do I not be one of those red figures that we just looked through? Or if you as a team leader or a leader of managers want to say, how do I reduce the risk of my team? This is a really good framework for you to understand how to reduce risk. So the first thing is the objective environment. This is the design of your space. So your desk, your chair, your work area, your aisles, your beds, your tools you interact with, your sonography equipment. This is your objective environment and the demands that those put on the individual. Then there's the objective person, which would be us, our stature, right? Our height, our strength, our mobility, our nutrition, our sleep, our stress levels, all the holistic things that go into our capacity to accept the demands from the objective environment. So when I'm going into these assessments that I do often throughout Loma Linda, the first things I'm looking at are the objective environment and the objective person and the fit between those two. When there's a misalignment, you're going to get coping, which is where you see that box right to the right of the objective fit. That's us trying to square peg round hole our workspaces, right? And sometimes that is a case that some of you are dealing with, right? Your workstations don't fit your body, your fitness, things like that. So the first goal of reducing risk is to improve the fit between the objective environment and the objective person. And we're going to talk more about how to do that in the second half of this. The subjective environment is the next variable, and that is our perception of our environment, right? How we feel about our workspaces. So maybe the actual objective fit is fine. When I go and look at a space scientifically, the heights, the spatial arrangements, all that is okay. But maybe the desks are from the 70s. Maybe the carpet stinks. Maybe there's all these other subjective factors that say, you know what, I don't feel good in this environment. That is a factor that you have to address if you really want to reduce risk, because the perception of the space matters. And then there's the subjective person. So that is what we feel about our capacity to do the work. And a lot of times, things like staffing, hour burnout, patient load, things like that can change our subjective capacity to do the work that we're being asked to do. And when you have a misalignment of the subjective environment and the subjective person, how I feel about my space, how I feel about my ability to perform the job, you get defensive employees. So this model, anywhere there's a breakdown, it could be any one of these corners, your risk of injury, strains, illness goes up. So again, my job is to look through all of these corners and try to give some recommendations, both short-term and long-term. Sometimes it's something simple, like a chair, right? Or a desk. Sometimes it's workflow, or it's staffing strategies and things like that. So there's a lot we can do to improve in all of those four corners. And that's where the rest of this presentation is going to go. But before we do that, I wanted to make sure that we stop and have a second if anyone has any questions about the start of this presentation.
Thank you so much, Aubrey. And this is a great reminder for our viewers. If you are watching us live, you can actually type in the comments section any questions you might have for Aubrey, and we will ask him live in today's session. Aubrey, you talked about objective and subjective when it comes to, the office environment or the environment you're working in, your body. I would assume that a lot of us think of when we're doing work and our body starts hurting, we usually say, oh, I've been doing this too much, or I haven't been using body mechanics, or I'm out of shape, or I'm overweight. So we start blaming ourselves. When is it a good point to actually start asking questions about our environment? Because sometimes we don't even think about that. When should we start asking those questions, I guess, is the first question. The second question is, what questions should we be asking?
No, that's a great question. So my short answer to that is right away.
Okay.
So whenever you have pain at work, you have to look at both sides of that objective equation. What can I do to improve my capacity? So things like improve my posture, improve my strength, improve my mobility in some cases, improve my nutrition, but also what is awkward in my space. And you don't have to be an ergonomist and know this big, huge, fat book to know what feels awkward, what feels uncomfortable, and start to take the time to diagnose, okay, how does that relate to the pain I'm feeling? And you can start connecting some dots on your own right away. And then when you need help, that's when you can reach out to my office, which I'll give you the information on how to do that later.
Okay. So to our friends, and this question is, what if we don't have an Aubrey in our organization, or a lot of times people are working from home and that type of thing? What kinds of things should they keep in mind when we don't have an Aubrey to come and do an assessment for us?
No, that's a great question. So even if you do have an Aubrey, I'm one man, one person. So sometimes it's slow. I have some teams waiting on me for a while. So there's that. But also, like I said before, you don't have to be an ergonomist to start understanding what's awkward and what feels uncomfortable, and to start to self-diagnose or self-prognose the relationship between pain and space, right? When I feel pain, I'm doing this. Where are my postures? What feels good? What feels bad? A lot of times when I go out and do assessments with people, we get so stuck into get it done mode, get through the day mode, that there's all these little intricacies. When I just show up and start asking questions, people start thinking through and answering their own questions, right? By playing their day out intentionally. So be intentional about when you feel pain. Be intentional about how you go through the day, what is causing it. Start to think about what postures, what positions feel good, feel bad, and self-diagnose. That's the first step. You can do, I'm going to give you a lot of self-serve information. So you're teasing the second half. I appreciate that. That's going to help for anyone that is watching this. And there's going to be more information. That's part of when I got hired. One of the big goals I had here is to give a ton more information out. So all of that's been curated over the year or so I've been here. So more of that will be coming.
Okay. And then maybe one more question. Let's fit in one more question before we go to your second half is, should we be concerned about ergonomics in children?
Ooh, that is a fantastic question. So yes, some of the issues, again, I'll talk about in the second half, originate from some of the poor biomechanical behaviors that we develop early. Yes, 100%. Especially as sitting has gotten more prevalent, cell phone use has gotten more prevalent, computing has gotten. So absolutely, what I would recommend is anything that you are currently dealing with in terms of pain, maybe you and your small circle of people, take those lessons learned and teach those to your children, because they need to understand how to control their posture, how to use the equipment, the mouse, the keyboard, what postures to avoid, what strength they need to have, all those different things. Again, I'll talk more about in the second half, but absolutely, because it is really difficult to overcome really bad biomechanical behaviors that are locked in.
Okay. Well, thank you, Aubrey. Well, why don't we get to your second half?
Yeah, perfect. All right, all right. So what can we do now? And a lot of this has been teased, so this should be fun. There are things that I challenge people to do at an individual level, and there's things that I challenge myself and the institution to do to reduce risk. So we'll break it down into those two sections. So on an individual level, here's a big picture look. There's 8 things that I look at from an ergonomic perspective. You could probably finesse a couple more categories if you really thought through the research, but mobility, strength, physique, nutrition, sleep, posture, stress, and your workflow efficiency. Those are the 8 things that I'm looking at as an individual that you have some control over, that you can do to increase your capacity to do work and decrease your risk of injury. So we're going to go quickly through each one. And for each one, there's going to be resources that if you're signed up for CEUs, you can get through that portal, or that the Living Well team can send to you if you'd like. But for mobility, there are normal ranges of mobility. Okay. My question to you all, or anyone who watches this, is do you know your normal ranges of mobility? Do you know if you're normal, if you're abnormal, where you're abnormal? That would be a baseline. And since our injury rates in healthcare are higher than normal, then I would challenge us to know more about this than the average worker. So here's 2 examples that you can do right now if you're watching this. So internal and external rotation of the shoulder. So if I take my shoulder here, I should be able to get at least 90, for females slightly beyond likely, with no pain, no inhibition. Internal rotation, I should be able to get somewhere around 70, no pain, no inhibition. If you have issues with that, you have increased risk of injury in that space, right? The more mobility you have, the more you're closer to the normal ranges, the more of an increased capacity to do work you have, okay? Wrist, same thing on the right side of the screen here. Okay, for flexion, I should be able to go, if you can see this, hopefully I can dial it in. I should be able to go right there, 80 to 90 degrees, no pain, no inhibition. Extension, 70 degrees or so, no pain, no inhibition. Same as shoulder. If you're limited, that means you've increased your risk of things like, tendonitis, carpal tunnel syndrome, things like that. So know your mobility. There's a resource, again, that will be sent that has all these normalized ranges, and you can check yourself. Strength and stability. So there are a lot of different methods for measuring strength, stability. My recommendation is for you as an individual to know what standard you want to hold yourself to for strength and stability. I personally like using functional movement screening as a tool, but you can find any tool that resonates with you. The goal, though, is to have some sort of measure for yourself so that you know how you stack up. Here's an example, the deep squat. This is a exercise, in my opinion, unless you have permanent disability, that prevents you from ever doing this. It's a movement that everyone should strive to work towards. The better you are at it, the decreased risk you have of lower extremity injury. It's just a fact. So find your standard. Again, I have my standards in the resources for this. Physique. The ACE, American College of Sports Medicine, has standards for body composition. There's numerous tons of research on the interrelation between body composition and musculoskeletal disorder, your capacity for injury. Prevention goes up as your body composition improves. So know where your ranges are for you, know your standard, just improve. Improving here means reduce risk. Shout out to the Living Well team. I have to put this on here. For every ergonomic assessment I ever do, every single one, I send out a recommendation to check your wellness score. It's a great tool. It's going to give you a baseline, and I'm a numbers person, so I see the number, I want to improve the number, and it's a simple way to measure your success. And you all kind of get the theme here. There should be some standards for yourself on these things, and not just float through life and have no idea how you're doing day to day, week to week, year to year. Sleep, same. There's been some situations where I'll go out and I will, assess a workstation and things, and the workstation is fine, but the person just they're just so lacking in some of these areas. Sleep is one of them, and it may not be amount, it may be quality. But the idea is, I recommend, if you haven't done an assessment of your sleep, do so and try to set some goals to improve. All right, so posture, the thing that everyone wants me for, is posture, even though that is one piece of the puzzle. But for posture, there's some general guidelines for posture and computing. You're seeing the overview here: thighs parallel, leaning back slightly, keyboard at elbow height, eyes slightly below the monitor. Those are the big four. If you can get those right, you're in a great space. But there's a handout on this that is also in the course materials for this. And it's a simple checklist for you to go through to set yourself up. Now, if you can't do this, that's where we would change the objective environment, right? Where we change the workspace, maybe the desk, maybe there's some additions, chair, things like that. And for standing, it's very similar. But it's not just about typing. We don't just do typing. There's just overall general postural concerns to be aware of. These are the four I see the most. So if you want to reduce your risk as much as possible, posturally, these are the four things you would look at. This first one is called thoracic kyphosis. That is the rounding of the shoulders you see there and the accessory tightness and weakness. There's a handout on what this is and how to correct this in the course materials. Forward neck posture, okay, or cervical hyperlordosis. This forward neck posture. This is one Olivia brought up the kids, right? This is one we're seeing a higher incidence of now because of cell phone use. So how to correct that, that's connected to the resources in this. Hyperlordosis, that excessive curvature. A lot of you who feel uncomfortable in your chair, this is what is happening. Tightness here, tightness here. Resources for that to correct are in the course materials. And then the last thing are these wrist postures. Quick tip, when you move your mouse, you shouldn't move your wrist. Some of you, that might blow your mind, but it's such a simple thing that you've never been taught how to use a mouse. But you shouldn't move your wrist. Elbow should move the mouse because these wrist postures are devastating to the tendons and nerves. Okay, a couple more things here. Stress, again, shout out to the Wellness Living Well team. Make sure you utilize that resource. More stress, reduce capacity to do physical work. And then efficiency, there are a lot of ways to look at efficiency. I like to look at it in terms of reducing waste. So there's a tool that's in the resources about reducing your waste in all of these different areas. The more efficient we are, the less biomechanical stress we have, right? So if you do not, every year or so, take time to just look at how you can reduce waste in your process. Last thing here before we get to the last Q&A. For the institution, there are 4 asks from an ergonomic perspective. Look at risk and waste surveys of your people. So talk to your frontline people. Look at ways to improve efficiency. Expand your change management. Make sure that when you're doing change of workspaces or workflow, that you're talking to your frontline, that you're talking to the stakeholders who know how to design space. Know your injury cost. Sometimes it's hard to make decisions to change space because it can be costly. But knowing your injury cost can give you the tools you need to make those decisions financially. And then the last thing is fiscally sustainable decision making. And that's really about thinking long term. It's hard to spend $1,000 on a desk, $500 on a chair sometimes when you think about it in terms of an annual budget. But when you think about it in terms of 10-year, 15-year windows, sometimes these decisions make sense. So that is it. For the content, like I said, there's a lot to talk about here, but a lot of what I reference, I wanted to give you the tip of the iceberg because there's a lot of content that goes with all of these pieces that you can dive into based on your own situation.
Well, thank you so much, Aubrey. That was hugely informative. And I want to talk about the resources that you actually have. If you're watching this video for CME credit, you can get that off the website. If you are not, feel free to email livinghole@llu.edu. That's livinghole@llu.edu, and we'd be happy to send you some of Aubrey's resources. So, Aubrey, we actually have a question coming from YouTube, and the question is, are kneeling chairs good for you? Now, I want to kind of piggyback on that because kneeling chairs was a huge, fad, I think, for a while. And then also these yoga balls. So could you talk to both of those?
Yeah, so it's all about fit. That's why I always put that model because I'm always going to go back to that anytime somebody asks me a question like this. So if you have the physical capacity to use one of those and maintain the proper postures while using it, then go for it. I'm going to tell you right now, though, it's really hard to do that for 8 hours to 10 hours. Your core will be on fire if you do it appropriately. But they're totally fine if you can maintain the right posture. So a lot of times you have to work your way up to using it in longer durations. But they're absolutely fine. I wouldn't say they're good baseline, but I will say if you have the strength, then it makes sense.
And I would assume, Aubrey, these things can actually injure you if not using them correctly and appropriately. So you're trying to do something good for yourself, but then you actually injure yourself in that process, which can be hugely frustrating. So you want to make sure you do a self-assessment before any of that.
Absolutely.
So another question, you talked about sleep in your presentation. Now, what would you tell a person? Well, what does sleep have to do with work and ergonomics? Could you make that connection?
Yeah, so I think what happens is we look for the path of least resistance when we're in pain, and we try to look for tools to solve our issues. So if I get this new keyboard, if I get this new desk, if I get this new chair, if I get this, but the reality is the musculoskeletal disorders are multifactorial, and we just have to accept that as baseline. So if you are having wrist pain, you need to look at what are the postural things, what are the tools I can change, and you need to look at nutrition, sleep, everything else. Because when the other things are off, your inflammatory control is off, your hormonal control is off, and your ability to recover from work is compromised. So now the repetition that somebody can handle just fine, you can't. And so you have to look at the big picture. And part of me bringing that up is to take some pressure off myself. Okay, I can't solve all your problems. It just won't happen. We have to work together and look at all of the picture.
So, Aubrey, what would you tell someone who has been doing, we're just going to use a kind of a generic desk job for many, many years, has also been in pain for a long time? What is the light at the end of the tunnel, or what kind of encouragement can you give this person? Can there be some alleviation of this pain that they're in?
I mean, depending on the longevity of the issue, I'm not going to sugarcoat the fact that it may be a battle. It just may be. Um, but the
But not
goal of
hopeless. Is
orienting the,
that what I'm hearing? Not hopeless.
not hopeless though,
Okay.
not hopeless. It may be a battle because the goal of orienting the presentation this way and giving so many pieces is that there are going to be pieces that resonate with different people. Um, and the goal is to look at each piece and be as good as you can be in each piece. And that's going to give you the best chance you can. I've seen some really hopeless cases turn around, but it takes a really big picture look at all of the factors to give yourself the best chance, especially if you've been dealing with the pain for a long time.
Okay. Well, Aubrey, thank you so very much for being our special guest today. And I want to thank you all for being our viewers. One of the take home messages, Aubrey, that I think you've kind of emphasized is that number one, there can be hope, but it cannot get better if we don't analyze it. If we just ignore it and continue to ignore it, it's never going to get better, which is actually a take home message for a lot of things in our health and wellness. But again, thank you, Aubrey Prince, for joining us today. And thank you. And I want to encourage you to be well. Take all of these things. And now we are starting the new year. It's a great time to make some changes. My name is Dr. Olivia Moses. Thank you for joining us on Wellness Live, and we'll see you next month.